thank you for participating in the Wellness Wave brought to you by ACP Region 3. My name is Isha Lal. I'm a medical student at UCSD School of Medicine, representing the CA-ACP Chapter 3. Today, I'm honored to interview Dr. Mazzotta. So Dr. Mazzotta, can you tell us a little bit about yourself and what you do?
Isha, thank you for accepting me. I'm a retired now gastroenterologist, and I worked in a small community upstate New York, approximately 100,000 people. Majority of my cases were in the community, and most of that were people who worked in companies such as Alcoa and major General Motors. And there were 4 universities, and the problems that I saw mainly were addressing primarily things that happened with the community and outside of the community. These were including things such as behavioral modifications and things that people were doing, and especially problems with alcoholism and drugs.
Wonderful. Thank you for sharing that. And can you tell us a little bit about how you chose that specific career path in medicine?
I think it was more gravitational. Many years ago, I had the good fortune to meet up with a gastroenterologist who explained in GI terms that everything revolves around the GI tract. It didn't matter who you were, where you were, it was all GI. And I kept that in my back pocket, and I went through my medical school and my residency and fellowship with that in mind.
Yeah, wonderful. Thanks for sharing that. We've been learning a lot of similar things about how important the GI system is to like your whole body. So, do you have any advice for rising medical students or current residents as they're trying to figure out what path to pursue?
Well, my experience has been that advice and advise are 2 difficult things to give young people. It was difficult for me to accept, and I'm sure it's the same. But I had some guideposts, and they're very simple, and I kept them simple. And the first one was being credible to yourself. It's very important to understand what you're going to contribute and how vulnerable you're going to be to the world. And the second thing is you have to practice what you preach. In other words, if you're going to tell someone uh, your thoughts about their care, you need to be able to back it up. You need to have a purpose for what you're doing, and that's very important. The other thing I think, which is you've got to make it a reality show for yourself. You have to take risks. You have to be able to stand up and say, okay, I know I am who I am, and I know I can and cannot do this. I think your attitude has to be very positive. I think you need to make yourself avail of the fact that when you present yourself to someone, you want to make yourself as positive as you can and be realistic. Okay. And I think you need to also balance things, balance your home life, your professional life, and things that are basically under your control. I think you also need to challenge yourself. I think you need to be able to say to yourself every day, am I doing a good job? And what can I do that's even better than what I'm doing now? I think things like, this is personal, I think going to a good theater, listening to good music, at least in my generation. And I think I read a poem every once in a while, and that helps me go. And I guess I'm on some kind of a situation here that it may sound a little odd, but I use a lot of LSD. Now I know your eyes are opening, and that stands basically for laughter, and I
Mhm.
sing and I dance, and I do that every day. Now that may seem odd to you, but it helps me go.
That's really beautiful, and I love that the laughter, singing, and dancing. Can I ask you what your favorite poem is? I love poetry
If
myself, so
if I like if the poem if.
if okay, I'll have to read that.
Okay.
Okay, so now just transitioning on to some of the wellness questions. Do you have any advice for young physicians, medical students, residents on how to handle perfectionism in medicine?
Well, perfectionism, I think, is a little overboard. I mean, to say you're perfect in anything, you're really complimenting yourself and patting yourself on the back. Your mentors, your teachers, I know they sometimes seem a little odd to you, but they're your training wheels, and they will get you through this maze of self-doubt, so to speak. And eventually, as the residency continues and you go to being attending, if you so desire, the world changes for you, because then you are the person that has to make the decision. Uh, when you say perfectionism, and it carries a big burden, and it's a burden that you do not have to carry. You can make a mistake as long as you correct it. I'm not saying you should do many, but you should learn from them. And one thing, if you're going into a private practice, um, people may give you accolades. However, you don't want accolades. What you want to know is the person who says, gee, I wish I had come someplace else, or I wish I had gone somewhere. You need to find out what that problem is and correct it.
Thank you. Thank you for sharing. That's really helpful advice. And then our next question would be, I know you gave us some tips on what you like to do to like stave off burnout, such as like the LSD, the laughter, the singing, and the dancing. Do you have any advice on medical students on how to develop their own personalized toolkit to manage the stressors that go along with medicine?
Well, um, that the very first part was basically a rendition of a CPR and ABCs, your
Mm.
credibility, your purpose, your risks. I think everything is based upon yourself. There are no specific answers. What makes you comfortable in your own way, you're going to project to someone else. So if you're finding that you're having difficulty with communication, and communication is not a language thing, it's basically taking knowledge that you have and bringing it out, explaining it to the patient, or explaining it to your friends or your mom and dad, whoever, and telling them, this is the way I think, and this is the way I'd like to present myself. And I think that's important, because if you're not being truthful to yourself or trustworthy, you're going to have problems later on. Not so much with your patients, but with yourself. And I think that's one of the key problems that people have with the disease of the month now is burnout. It used to be PTSD, and it goes on. And I think you have to remember that people have been burning, quote unquote, for years. It's that the fact that the social pressures that you have as a student, as a young person, are astronomical. You're talking to a screen, and you probably do that 24/7. You don't talk to people, you talk to screens. And I think it's a social, you say social media, I call it a social mistake or
Mhm.
distraction. Sorry. As far as toolkits, I mean, I don't have a hammer or a screwdriver or a pair of pliers for you. I think what you need to do is find yourself, and that's it.
That's really powerful advice. Yeah, thank you for that. And then my next question is, do you have any advice on how students can remain strong when dealing with difficult patient situations?
If you look at the patient as a problem, then you have a problem. You have to look at the patient as someone who comes into a portion of life in which they have a turning point. There's a tipping point. He or she is going to make a turn somewhere along the line, and their body is responding differently to what they're thinking they want to do. And so the difficult patient, if you mean in academic ways, then I think you need to go back to your books and study. As far as being difficult to you personally, find out why they're angry. I've had patients come in, and I know just their body language that they have an issue. It may be with medicine, it may be with me, it may be the color of my hair, so to speak, when I have. But it's something that is important to find early on, and that's what medical students and residency and fellowship training is all about. Look
Wonderful.
look at the patient. Don't look at your subspecialty.
Mhm.
Mm.
Perfect. And I'll remember that too, is remember to ask why and pay attention to the patient. So thank you. My last question for you is, do you have any input or advice on how we can create a culture of wellness in medicine on a more systemic level?
Well, that's an interesting question. I don't have an answer for it, but I would a direct answer for it. But I would say with any system, the system has to be adjusted on the inside, not on the outside. And if you're looking for um, an answer to a system, I think you have to study the kind of building blocks and how you are there, how you arrived at the problem. I think medicine right now, and I know it's going to sound like a downer, but you'll be practicing less medicine and more worldly things than you know, if unless you stay in academics, and then that's even more difficult. But I think one of the things that you should try to do is be the perfect example of what a physician in your mind should be. If once you change, then you're basically giving into the system, and the system is not geared for physicians to make decisions for the system. I don't know if that's going way overboard, but a systemic change has to come from within. And the culture that we have today is obviously different than when I came through, but it's too diverse. And I know my daughter, who's a psychologist, will probably hammer me on this one, but you have too many choices, and it's very difficult. And you need to categorize them and make them accessible to yourself. And that's about the best I can tell you.
That's really great insight. And you're so right. There is so much of a diversity of choices that it can really feel overwhelming at times. But thank you. So, yeah, I just wanted to say thank you so much for sharing your knowledge with us, Doctor. I really appreciated this conversation with you, and I know that everyone who views this video is going to benefit immensely from your wisdom and your knowledge. So I just wanted to thank you again for your time.
Thank you. Thank you for interviewing me. I appreciate it.
Thanks.